Hey everyone, it's Nurse Gladys here today and welcome back to Nurse to Follow. As we embrace this season of joy and celebration, I also want to bring attention to an important issue that affects many couples: infertility. Now, whether you're a couple trying for your first child or facing challenges with subsequent pregnancies, today I'm here to shed light on this often overlooked issue with you all. So please dive in with me as we understand more about infertility and its impact, and of course, some contributory factors of infertility in most men and women. Stay tuned. To begin, let's define infertility. What is infertility? Infertility, in simple terms, is defined as the inability to conceive after 12 months of regular unprotected sexual intercourse. It can also be referred to the inability to carry a pregnancy to full term, that is, for complete 9 months, usually leading to miscarriages or stillbirth, where you give birth to a dead child. Also, it is very common for people to assume that after the first pregnancy, the next will be just as easy. However, it is not often the case. You have what is called secondary infertility, which is the struggle to conceive or carry another pregnancy to full term after having your first birth. So after having your first child, it takes quite a while to take in again for the second child, despite your regular unprotected sexual intercourse. Research indicates that about 30 to 35% of infertility cases originate from female factors, and about 20 to 30% originate from male factors, and the remainder, of course, from combined or unknown causes. But whatever the cause may be, recognizing some contributory factors of infertility, both for men and women, is crucial. It's very important that you know these contributory factors. And we are going to discuss those factors beginning with men. So what are some contributory factors of infertility for men? You have one main contributory factors for men: low sperm count. Now, an average male adult should have a normal sperm count ranging from 20 million to 150 million sperm per milliliter for an average male adult. Now, a low sperm count will be below 15 million. So a sperm count of 15 million and below is considered abnormal, and that is going to affect the sperm motility, the sperm shape, and it's really going to affect how viable your sperm will be, how well it can fertilize an egg, its ability to swim to an egg and cause fertilization is going to be limited or slowed down. So low sperm count is one major contributory factor for male infertility. You also have the health of the individual, the general overall health of the individual, and some risky behaviors. So you have pre-existing conditions like diabetes mellitus can affect the sperm shape, the sperm motility, and it can also limit a man's ability to impregnate a woman. All these affect sperm production. So you have risky behaviors like smoking or excessive alcohol consumption, exposing your testicles to overheat, so much heat. For instance, if you're a man who has a habit of having warm top all the time, if you're putting on tight pants most of the time, this increase heat production around your testicles, and that is going to expose your testicles to so much heat, and that affects sperm production. So if you're a man and you're planning to impregnate a woman anytime soon, or you are already in the struggle of having a woman pregnant, avoid these risky behaviors. Avoid smoking, avoid consuming excessive alcohol, avoid taking warm top, avoid very tight pants, things that will increase the heat around your testicles, things that will expose your testicles to overheating. Avoid those behaviors. And of course, if you have diabetes, put it under control, because uncontrolled diabetes mellitus does affect sperm production, sperm motility, the sperm shape. It affects your ability to impregnate a woman. Turning to women, ovulation disorders are the most common cause of infertility in women, which impacts the release of eggs from the ovaries. And just like men, certain conditions like diabetes mellitus, sexually transmitted diseases like HIV, most STDs, these can also affect fertility. They can affect the ability of a woman to conceive. And of course, risky behaviors like alcohol consumption, the use of tobacco, the use of illicit drugs, and things like that. This can go as far as affecting your ability as a woman to conceive. Other risk factors that can contribute to female infertility include factors like overweight. So if you're a woman and you are overweight, your chances to conceive are reduced. Not for everyone though, but it's a risk factor. You also have some uterine conditions like endometriosis. Endometriosis is a condition whereby uterine tissues that are normally supposed to grow within the uterus start to grow outside the uterus, and this can cause a lot of bleeding disorders or menstrual irregularities or abnormal bleeding cycles in a woman. You have contributory factors too, like fallopian tube disorders. Especially if a woman has had an ectopic pregnancy before, this can cause damage to the fallopian tube, and it can go a long way to affect conception again. And advanced maternal age is another contributory factor of infertility in women. So as a woman ages, especially after the age of 35, you start having, you start to struggle more to conceive. Or even if you do, there are usually some risks attached to the pregnancy, like chromosomal abnormalities or difficulty carrying the pregnancy to term, or having some pregnancy challenges. So these are some contributory factors of infertility in both men and women. Now, when should you follow up with a doctor? When can you follow up with a physician? As a woman, if you start having irregular menstruation, I think it's time to follow up with a physician. If you start having abnormal bleeding cycles, like heavy cycles or very brief cycles, or unpredictable, bleeding, you should see a physician. You should see a physician. If you're a man and you notice that you have difficulties with ejaculation, reduced sexual desire, or erectile problems, that warrants a medical checkup. I advise that you go see a physician. Please, if you found this information helpful, like, share, and subscribe. Thank you all for tuning in today. I wish you all a Merry Christmas and Happy New Year in advance. And always remember, you are not alone in this, and there's always hope and help available. Do have a good rest of your day, and see you in my next video. Ciao.